Hello, my name's Bob Doman. I'm the founder and director of the National Association for Child Development. This little video is part of a series of videos we're doing relative to issues confronting children with Down syndrome. In this particular video, I want to talk about academic function, reading, math, understanding the child, understanding what is appropriate and how to maximize our academic function. I've actually been working with children with Down syndrome and academic function since 1970. Matter of fact, I sent my first Down syndrome little girl to a typical classroom in 1971 and sent her into first grade academically on about a second or third grade level. Since that time, we have thousands of children who have developed normal academic function, many of whom start off school above their peers. It's very possible to educate children with Down syndrome if we look at the educational process as part of the global process of working with a child. In a previous video, I addressed the issue of sequential processing. We look at auditory and visual sequential processing. Sequential processing essentially determines how many pieces of information your child can take in and the complexity of thought. It's mandatory that you understand sequential processing and global maturity to determine what is appropriate when for the child. We don't want to look at a child's chronological age and attempt to plug them into a curriculum based on their chronological age. We want to identify where that child is functioning and then tailor-make the academic program to fit that child. If we really understand sequential processing, we can actually start educationally working with things like reading and math at a very early age. We actually start laying the foundation for reading with our children virtually at birth. And we start doing that by teaching them how to process specific visual coupled with auditory piece of information. Starting as simply as showing something and naming it, then showing them pictures and naming it, and then building a receptive vocabulary base, teaching the child and the child's brain, if you will, how to process that kind of information, teach the child to love processing that kind of information. And often we're already working on teaching the child to read specific words by the time they're 2 years old. Okay, and you can do this if you understand the pieces. All right, and one of the most significant things relative to the majority of children with Down syndrome, if you're teaching reading really needs to be sight-based until you have the auditory sequential processing up to at least a 5. At 5, you can throw in phonics, which is in fact a word attack skill. I have an issue with people talking about you have to use phonics to read. You don't read with phonics. If you as an adult read your newspaper phonetically, it'd take you 2 months to read your newspaper. You've used phonics perhaps as a word attack skill to learn how to read a word you don't know. But once you learn the word, you read the word by sight. So ultimately, that's where you end up. But that's an auditory-based approach, which generally our children are not ready for until they're quite a bit older. But we can, in fact, start teaching them to read at a very early age and read very successfully if we're doing it properly and we're fixing it, addressing it to the child. The same is true in mathematics. In terms of math, we start that very early on, and we do it very specifically relative to where that child's function is. Ultimately, how far the child goes in math is really a reflection of how far we've taken the child in their cognitive function. We can teach steps, we can teach skills, we can teach processes, but ultimately how well the child functions in math is a reflection of how far we've developed their sequential processing, their working memory, their executive mental function, their ability to think, conceptual thought. So there's a lot of pieces you put together. It's not simply a matter of here's a curriculum and we're going to plug the child into the curriculum. It's a matter of understanding the child, working at developing all the child's specific pieces, identifying inefficiencies, fixing inefficiencies, identifying strengths, working with strengths, having the child be successful, turning the child on to learning, and then continuing to work with all those pieces, constantly evaluating where we are, where we need to be, what's working. You know, typically, educationally, we've kind of blamed lack of learning on the child. I say the child doesn't have the capacity, doesn't have the capability, therefore we're going to go to plan B or plan C. The reality is, if we understand the pieces and address the pieces, we should be able to help all the children become pretty darn efficient, effective learners, and ultimately doing well academically. But we have to address the pieces. We have to work with that child as the unique individual they really are. So it can be done. Thanks.